It's my pleasure to be part of this Health Summit. And I want to say that this is not the first time that I'm invited by Dr. Patel. I go long way with India Health Camp, New Jersey, and I see myself participating in all India Healthcare Camp initiatives in future as well. My presentation is a little bit different, but many of you who have attended India Health Camp or GoPio Summit hosted by Dr. Tushar Patel, you may not be unfamiliar with the concept of self-care that I'm going to share with you. I want to clarify that what I'm about to share with you is not about COVID, but it is related to how we are feeling in this pandemic. Second thing, what I'm sharing is actually I'm sharing with you formula, a self-care formula that I developed during my expertise as a clinician, as a provider to my patients, and my years of engagement in the community. I remember in 2018 when Dr. Patel invited me to speak at the GoPio annual summit in New York. It was a consulate general building, and he said, "Will you be able to talk?" And my initial thought was to talk about stroke, which I always speak on, and educate community about how to prevent stroke. But at that time, I thought that there were some more important facts that I could share, and that can channelize segue to something which is very important to our lives. We not only need to prevent stroke, but we really need to focus on all other chronic diseases significantly prevalent in South Asian community as well as Caucasians, and I would say throughout the world. And when I started developing this concept, I presented at GoPio, and I haven't looked back. And that is the core component of my book that I'm working on. It's all about self-care. Without waiting further, I would talk about what does it mean? What does it have to do with COVID, and what is self-care? Why it is important now more than ever? So let's talk about what are we experiencing right now. We all are experiencing a unique phenomenon that we have never experienced before in our lifetime. After Spanish flu, this is another pandemic that has taken over the world constantly. The moment we wake up in the morning to the time we go to sleep, we are constantly engaging our thoughts into when is it going to get over? How am I going to survive? And what do I need to do to emerge successful? And how am I going to be a survivor? So initially, when I developed this concept of self-care, I call it purple prescription. I request all of you to do one thing. If you are having a piece of paper and a pen, then I want you to write something down on that piece of paper. So at the end of my presentation, you will be able to use it and take it home. Number one, self-care is very important. We know that. We all are aware of all the interventions and techniques that we need to do for ourselves. As a human being, if we think about our survival instinct, that we really will jump in and we will take care of ourselves. Number one, if we start having a cough, we will go and take cough medicine. If we have fever, we will take our temperature and we will take something so that our fever goes down. If we are feeling more sick, then we will pick up a phone and we will call our healthcare provider, a physician or a nurse practitioner. So we do have that survival instinct to take care of ourselves. But why now it's more important? So how I have developed this formula is make a mnemonic, which is called purple prescription. And purple is divided into 6 components, as you can see on the slide. P is for pause, U is for unwind, R is for relax, P is for play, L is for laugh, and E is to enjoy. And I will show this slide again at the end of my presentation as well, when I will explain you each component of purple prescription. So let's talk about why it has become more important for us to manage stress at this time. Today, what we are experiencing is a new experience. Not just the healthcare providers, but everyone is experiencing the ambiguity and what we really don't know about what's going to happen in future. Healthcare providers as well as people who need information about COVID, they are constantly struggling with new information, every day learning new facts from the media, and every day struggling to find out what am I going to do next. So the first P of pause is really important for us to take a moment every day. When you start your day, pausing is really important. Just think about it. How many of us, when we wake up in the morning, we really take time, and you really don't need to pause for 5 minutes or 10 minutes or 15 minutes. It takes is about 30 seconds to 40 seconds to 1 minute. Pausing is a way to train your mind to make choices. Every day when you indulge into any activity, any action that you take a moment to pause and think, do I need to do this? Or what do I need to accomplish today? That pause is going to give you that breathing space that you need when you begin your day. So when you're pausing, what is your brain doing? Before you do anything, you think about it and you question yourself. And in COVID, let me give you an example. When you pause, when you are starting your day, you're thinking, number one, what is the number one priority today? Is to take care of myself. I'm going to make sure that I have mask, I have sanitizer, and I'm keeping 6 feet distance from anyone. So that is the thought process when you start your day, when you pause. Pausing is before starting any activity, which gives you an opportunity to take assessment of the situation. You may not start your day similarly in same location. Some of you may be working in hospitals, some of you have other jobs to do, some of you work during daytime, some of you work during nighttime. Housewives, they have a different set of tasks that they need to complete every day. Children, if you are mother, parents of children who are doing schooling from home. So if you pause and think, it will de-stress. It will give you some time to address all your concerns from the beginning of the day, and pausing, just taking that time, taking a deep breath and saying that today I'm going to take one day at a time and I'm going to go forward successful, minute by minute, hour by hour, day by day. So pausing is one way of de-stressing. There are many ways one can use many intervention to pause, such as you can have a task list. First thing in the morning you do is a task list, which addresses what is your priority, what you are going to accomplish today, and what you are not going to do today. That way you do not feel distributed and you are focused on the most important activity of the day. Then comes unwind. Now, remember, pause is always before and unwind is after you accomplish something. And this I had modified for healthcare providers so that this could help them accomplish their day without having any stress. We all know that healthcare providers, they have gone above and beyond taking care of the patients throughout the state, throughout the country, throughout the world. So when pause is explained to them, I had modified the pause for them in terms of how we are going to enter patient's room. You're going to pause, you're going to make sure that you have all your PPE. That means you have gown and glove and the mask and respirator if you need an I-95, gown, booties, hat, everything before you walk into the patient room, and you have all the information about your patient, so that when you pause and you assemble everything, and when you walk in, you are ready to take care of your patient. Similar concept applies to everyone. If we are walking out of the house, if we are going to visit our loved ones, if we are going to a grocery store, if we are doing any activity of our life, we have to pause a little bit before assemble everything. Think, am I well protected before I'm stepping out of the house? And if you gave that time to yourself, your stress level is going to be low compared to if you did not prepare yourself. Check your car. Do you have enough supplies? Check your car if you have enough sanitizer. Check your car if you have enough equipments to protect yourself when you are going out of your protected environment. Similarly, when you come back after any task is completed, then you unwind. Unwind is just going over the process or going over your activity of daily life and checking it off. Did I come in contact with anyone that I should be worried about? Many patients, many people that I have talked to, I have requested, can you keep a checklist of people whom you met today? It just gives you a perspective that you did everything to protect yourself in COVID. Now you are unwinding, you are going over the activity of the day, and you are saying, I did this, I did this, I did this, and I took care of myself. I had mask, I had my gown and my gloves. Same concept applied for healthcare providers who walked in patients' room from one room to another. Did I wash my hands? Did I take off my gloves and gown in PPEs properly? Did I dispose them off properly? Similar concept applies to any layman who walks in the house, walks in the protected environment. Just unwind and look at your activities throughout the day, which will give you a sense of relief that yes, at every point, I took all the measures that will protect me from contamination or contracting the COVID virus. And when you come home, when you are coming in that safe and protected environment, you are not worried that you brought something inside the house. Now, coming to the R, which is relax. We know how to relax. Everyone says relax, relax. But there are many, many interventions, and relaxation is not same for everyone. Every person has their unique need to use a certain intervention that relaxes them the most. Some people use exercise, physical activity as their relaxation, while some people use yoga or meditation as part of their relaxation. So relaxing is part of our daily life if we know which intervention is allowing us to relax the most. Why relaxing is important and why consciously thinking about relaxation is important. The conscious thinking of relaxation engages one cognitively, neurocognitively. If you recognize that there is a stress mounting in your head and you really need to recognize that you are being stressed. At the same time, if you think about these thoughts in your head that I need to relax, just that thought itself will initiate another mental activity of thinking about the intervention that relaxes you. And you will find just checking that thought process will help you initiate whichever activity that you want to use, such as take a book, sit down, read, or find a quiet spot in your house, which is your favorite spot, and start your relaxation activity. It's really important to recognize that you are stressed and then immediately try to relax so that your blood pressure, your mental status, anything that is impacting your well being can be addressed. The next P is play. Now you must be thinking, what does play have to do with reducing stress, reducing agitation, or addressing the well being of our body and mind? Researchers and literature has advocated that just because we are growing in our age, we should not stop playing. And here, when I have included play in my purple prescription, what I'm trying to say is play anything that takes your mind away from the stress factor. You can play a musical instrument, you can play a game, or you can simply go out in the backyard, or you can play something with your children. The very beneficial effect of playing is documented in many ways. It increases your endorphins, just like how an exercise does. It takes your mind away, so you are completely having a devoid of thoughts when you actually engage in a play. Think about you who is playing in the backyard. Say you are playing a throw ball, or you are playing an Indian game, or you are simply playing badminton. Your complete focus is shifted from what you were thinking or what thoughts were crowding your mind to now, where am I going to hit the ball, or how am I going to position my racket so that I can hit the ball correctly, or how do I win? So, constantly engaging in play, if you are if you are interested in cricket, if you play chess, if you play a musical instrument, think about doing it, especially when you are experiencing stress. The L in purple prescription is about laugh. And when I was talking about, and when I was conducting the self care workshop with a couple of nursing health professionals, as well as some community members, I just want to mention that I completed two workshops under Dr. Annie Paul's organization, NINPA, that is National Indian Nurse Practitioners Organization. And what we found that laughing really reduces stress. And this is nothing new. Laughing yoga was devised and it was made very popular throughout the world by one physician in Mumbai who started laughing yoga. So, laughing can really reduce your stress. So, how many of us are actually laughing every day? Laughing, not just smiling or looking at a video, but sitting with people, sitting down at the dinner table and talking with family, reminiscing, thinking about old times, and just laughing with our open heart and mouth and with loud sound. It releases endorphins, it takes the stress away. It is one of the self care that we must do every day. And the last E is to enjoy. Just going back to laugh a little bit, the L, some of the people that I had discussed purple prescription about, because I am constantly communicating with experts, community members, and I asked them how do they feel about purple prescription. And some of them, they said, why don't you also say L is for love, love yourself, and L also for look within myself. What do I see myself as? And what do I need right now? What is most important for me? So, L can also be interpreted as look within, love yourself. The last E, I always tell everyone that E is really like a big building with a lot of floors. E is to enjoy. If you encompass E, a big E is enjoy your life. We all know that we are not in a very conducive environment, with not very favorable environment, but we should not stop enjoying our life. We have to steal small happy moments every day. We need to enjoy, we need to escape a little, which I meant was we do have to face reality, but at the same time we need to find those moments which we can use to escape, such as look at your family pictures, call up your friends, talk to your friends, talk to your family members who are across the country. Find those moments and continue to keep that bond, which gives us why we are existing in this world. All those treasures in our life. We need to really understand what is valuable right now to us. So we need to enjoy every moment. We need to escape a little. At the same time, E is also for exercise. We should not give up exercise even for a day because we know the benefits of exercise. When I was doing uh, chronic disease self-management program a couple of years ago, we have talked about exercise as one of the prime reason which can reduce the risk associated with chronic disease, especially for cardiovascular disease, stroke, osteoarthritis, diabetes. All those chronic diseases, exercise can have such a great and positive impact, and we all are aware. And eating right, eating and making healthy choices. This is another fact that we all know. And this is the reason we all know that we need to eat right. We all know that we need to exercise. We all know that we need to enjoy. But we really do not know how and when. So the purple prescription is nothing but using the mnemonics such as pause, unwind, relax, play, laugh, and enjoy. You use this formula to create a prescription for yourself, a prescription which you can write for yourself. You don't have to really go to make an appointment with a physician or a nurse practitioner or your primary. They are your guides, your primary physician, your cardiologist, your nephrologist, your neurologist, your endocrinologist. They are very important. You are going to consult them. But when it comes to the self-care, you are going to write a prescription for yourself because it's free. Purple prescription is free. You are going to decide how much do I need to pause? When do I pause? And how much do I pause? When do I unwind? When do I relax? When do I play? When do I laugh? And when do I enjoy? It's all in your hands. So, this is what I'm sharing with you. Use the purple prescription for your own self care because self care is important. If you take care of yourself, you will be able to take care of many things around you. You will be able to take care of your family, your own health, all your tasks that you need to deliver, and your entire day schedule will be in control by you. There are many people who can help you. If you think that when you are using purple prescription and if you still need help for your physical and mental needs, there are resources within the community. But taking care of yourself is very important so that you can live your life with much better quality. At this point, I will end my conversation here, my sharing here, as I work towards my book and which is expected to be completed probably a year. I will be happy to share with all of you again. In the meantime, I just wish you all a very safe and healthy year ahead. Continue to self-care because not only it is important for you, but for everyone who are in your family and friend circle because they all love you. And on behalf of India Health Camp New Jersey, who has always fostered the health of everyone through screenings, providing resources, and ensuring that we are here for the community's benefit. Thank you so much for listening to me.